Good afternoon, everyone. I just warm welcome to the IAP Ahmednagar District Branch, Maharashtra, for the today webinar by Dr. Ali Rani sir, the brain mapping. I just showed my gratitude to our Dr. Sanjeev Keja, IAP President, and Dr. Ruchi Vasma, IAP Women's National Head, for providing us this wonderful platform for sharing their knowledge. I just request all the delegates, please subscribe IAP India YouTube channel and other social platform of IAP to be get more updated with that webinars like this. Now, not taking the more time, I just hand over to our Dr. Deepak Anap. Please continue with your webinar. I just showed my gratitude to our Dr. Ali Rani sir. He is with us. Thank you, sir. Please continue, Dr. Deepak.
Good afternoon, everyone. I hope I am audible and visible to all the participants. On behalf of Ahmednagar District IIP team, I, Dr. Deepak Anap, convener district team, welcomes you all for this first webinar organized by our team. IAP, the Indian Association of Physiotherapists. We always hear this name. Everyone knows about IAP, but now this is new India and new faces with new association. And this is the team with motto to reach every stakeholder of physiotherapy community, including patient, students, academician, clinical physiotherapists. And I say my thanks to this team for allowing us to conduct this webinar. Then the state, Maharashtra state chapter, Indian Association of Physiotherapists, it is the most active state IAP team I ever have seen. Anytime we approached and asked for the help, they were always ready for any academic or clinical activity and any support. This is what we heard many times. United we stand, divided we fall. And we always need to stand united. With this motto, we started working on our district team. We need to unite to sustain and take our profession to new heights. We need to reach every physio, either from the city, urban area, or rural area. We need to aware the rural population about physiotherapy, education, and treatment. With these words, idea of district IAP team blinked when we saw the work of IAP Women's Cell activity. She, Dr. Suvarna Ganvir ma'am, EC member of IAP and coordinator IAP Women's Cell Maharashtra, she is our inspiring light and backbone. Only with her ideas, this district team came in existence. Otherwise, the task was very difficult and it was not possible. No novel work is possible without encouragement and support of experienced academicians and excellent administrators. These two personalities helped our team members to come on one conclusion, one platform, and showed a path which will help us to take a physiotherapy to a grassroots levels. And with this is our Ahmednagar district branch team, and you can see the members is a mixture of academicians, clinicians, government physios, and researchers. I, Dr. Deepak Anap, convener, treasurer Dr. Arjit Das, he is an academician, secretary Dr. Bhagyasri Jagtap madam, she is a clinical therapist, Dr. Smita Bankar, Dr. Amruta Maske, they are working in Civil Hospital Ahmednagar. Dr. Savita Gobre, she is a clinical physiotherapist. Dr. Pradeep Borkar is working as an academician, and Dr. Vaishali Kale, she is a clinical therapist. So our team is mix of all blends, starting from experienced academician to experienced clinicians. Though this is a first webinar, our district team has decided few more in upcoming months, and we will keep you updated about these webinars. We are going to organize the webinar for students, for clinical physiotherapists, and also for the patients. We are going to organize few camps, blood donation and treatment camps. So this is today's topic, which our moderator sir will introduce. Now I hand over to Dr. Vaishali Kale, ma'am, for further proceedings.
Good
Thank you.
afternoon, all. Good afternoon, all. Myself, Dr. Vaishali Kale. I'm going to introduce Dr. Vardajulu sir. Dr. Vardajulu sir, having the 24 years of professional experience in administration, teaching, and clinical areas. He is basically from Tamil Nadu. Graduated in physiotherapy in November 1996 from Tamil Nadu, Dr. MGR Medical University, Chennai, and MPT in Neuroscience in the year of July 2002 from the School of Medical Education, MG University, Kottayam. Presently pursuing the PhD in stroke rehabilitation from NIT University, Mangalore. His working experience is 24 years. He is presently serving as a Dean of Faculty of Physiotherapy, Krishna Institute of Medical Science, Deems to be University, Karad, from October 2002. He served as a Vice Principal, HOD, Associate Professor in Physiotherapy at Sridevi College of Physiotherapy under RGUS, Tumkur, Karnataka, from July 27th Feb 1997 to 10th October 2002. He has guided more than 75 PG students of physiotherapy presently working institute. He was awarded a distinguished service award at 54th annual conference IAP held at Shady on 19 February 2016. He was awarded Best Physiotherapist Award 2020 at MGN International Conference held at Goa on 22nd January 2020. He published five publications as an author, more than 25 publications as a corresponding author. He is certified Bobad practitioner pursuing a PhD in area of interest. He is a research person for various topics of neurophysiological approaches. He organized first state of level conference in Maharashtra at Karad on 3rd March 2007 with Ali Irani sir, former president of IAP, as a chief guest for the purpose of interacting with physiotherapists and physiotherapy students of Maharashtra. He organized a unique national level physiotherapy KNOSP 2016 in September 2016 with the team of professional awareness from the known to unknown. He contributed his knowledge to setting up this standardized syllabus, examination of pattern and ethics of practice of physiotherapy by using BOSS expert. The Board of Studies expert, Kerry Institute of Belgaum, Pravara Institute of Medical Science, Loni, D.Y. Patil University, Pune. Thank you, sir. Now I request to Dr. Varjadulu, sir, for further procedure.
So very good afternoon, one and all. It's my great pleasure and privilege to be the moderator for this particular webinar. And before I'm introducing the guest speaker, I would like to thank the organizers as well as the CEC of IAP, Central CEC of IAP and the State CEC of IAP and Ahmednagar branch, especially my friend Dr. Deepak Kanap. So again, the madam who has introduced me in this global platform. Thank you very much for all of you for giving me the opportunity. And today we are all going to know about Dr. Ali Irani sir, and who is going to deliver a lecture on brain mapping. And in fact, Dr. Ali Irani sir does not require any introduction because his name is famous for dedication, famous for the commitment, famous for the inspiration, and many more things that he is well known. He has taken our profession to one level to the another level, from the national level to the global level. He has taken our profession into various heights. He has taken also, now he is into the same process even today. But still, as a part of the formality, there are some more juniors who may not be knowing. For them, it is my pleasure to introduce Dr. Ali Irani sir, who is a graduate in physiotherapy and double PhD program, PhD holders in sports medicine also, on anatomy of the body, and doctor of physiotherapy under NUMS Spain. So presently, he is designated as head of the Department of Physiotherapy and Sports Medicine Rehabilitation Center, Nanavati Super Specialty Hospital, Mumbai. He is a chairperson, International Affairs, Indian Association of Physiotherapy, principal, NMIMS University, and sir is having an experience of like physiotherapist for the Indian cricket team from 1987 to 1997. This is the reason he is a key person who has given an idea to the various universities to start them sports physiotherapy centers at the various universities. We are proud of him to have as a physiotherapist in our country, and he's a member of Board of Studies, NMIU University. Worked as a researcher at Bombay Hospital 1985-86. Presented papers on knee mobility, backache, hammer toe, or various upcoming topics at various physiotherapy colleges and medical colleges. Conducted a workshop for Iranian Physiotherapy Association in 2004, and again in February 2005. Set up a physiotherapy and rehabilitation center in Bhuj, Gujarat, for earthquake victims, and examiner and lecturer for students of Masters of Fine Arts, Dance within bracket, Bombay University. PhD guide at various universities in India. Lectures on disaster management. Is the only resource person, pioneer, who used to deliver a lecture on disaster management, which has been approved by the various organizations. And sir is having so many awards. To list out few: the Hitra Horation Award in 1994, Lifetime Achievement Award by the IAP in 2004, awarded fellowship by Indian Association of Sports Medicine 2005, awarded fellowship by Indian Association of Physiotherapists 2005, Best Citizens of India Award 2011, Best Physiotherapist Award in India from Medscape in 2014, and he, of course, his memberships are very first in his list is a patron member of Indian Association of Physiotherapists, life member of Indian Association of Sports Medicine, Vice President of Bombay District Sports Medicine Association, Vice President of Bombay Southern Amateur Athletic Association, Gujarat Physiotherapy Council member, Maharashtra OTPT Council member, like this, many more in his list, and his name itself is enough for the introduction. In fact, we are very much glad to listen to him, and in fact, for me also to be as a moderator for this topic, which is a topic of my own interest also, to moderate the same in this bigger platform. Once again, I thank all the concerned who have given me the opportunity to be as a moderator for this precious webinar, and I wholeheartedly, on behalf of the Indian Association of Physiotherapy and Maharashtra State IAP and Ahmednagar branch of IAP, and on behalf of one and all of us, we wholeheartedly welcome Dr. Ali Irani sir to start with this session. Good afternoon and welcome, Dr. Ali Irani sir. Over to you, sir.
Good afternoon, everybody. Respected Dr. Varadarajulu, thank you for your kind words. Thanks to Deepak Anam, who has been following and tracking me down. Sham Ganveer, respected Sham Ganveer. Suvarna was with us for a long time in Mumbai at our hospital. Thank you for making an initiative, Suvarna. And I could not refuse you when you asked. And if Dr. Kale is there, Sudeep Kale, Vaishali Kale, thank you to all of you all, the organizing team, and thank you to Ahmednagar branch of IAP. Great job, and I hope the students benefit with such webinars going on. Dr. Vardharajulu, I remember coming to your college, university twice, and both the time the memories are still there.
Yes,
I hope you are doing great work and you continue. And my congratulations seeing you from head of the department and principal to the dean. May you one day become the vice chancellor of the university.
thank you, thank
All I
you. All
pray
the
for you.
blessings, blessings.
Today's topic is, can I share my presentation? We start.
Yes, sir, you can.
A minute, I will, yes. I joined Nanavati Hospital in 1987, 1st July. So this year it will be 34 years that I am at Nanavati Hospital. And I very strongly believe we all of us are going to journey to this life only once, because there is no proof that we were here earlier. And when I say proof, there is no scientific proof that we were here earlier. And neither there is a proof that we are going to come again. So we are not going to pass this way again. So let's do our best and be remembered. Let us be remembered by the world for the good work that we have done. So our topic today is something very different, very new for the field of physiotherapy. It's almost 12 years I've been working on brain mapping in physiotherapy. And we all know sitting here, we have a brain. That's why we are sitting in front of this lecture. Just a slide to show you everybody has the left side and the right side of the brain. As we know, if you're reading it, the right side controls the rhythm, pictures, dimension, and imagination. The left is for mathematics, logic, language, and analysis. The other way to look at it, the left side is the male's brain. The men use their brain box-wise. They go to the box, finish the work, put the box back, and go to the next box. It's only a female brain that can do multitasking. At one time, they are sitting here, they are listening to the lecture, but they must be typing, playing with their WhatsApp, or talking to their friends, depending where they are and what they are doing. So multitasking usually is done by a female, and they are very good at it. They can do many things at one time. So yes, of course, all of us have the right and the left side. So let us find out that brain consists 20 billion neurons, which generates electrical impulses called brain wave pattern. So we have to understand now what we are going to be showing you all as far as brain mapping is concerned. They are cyclic wave-like in nature and are measured in hertz. Hertz means frequency of cycle per second, frequency per second. And they're analyzed through electroencephalography, EEG machine. Earlier, the EEG machines were too big, but nowadays the portable machines are present. So this is how earlier machines of EEG looked on your right side. And what you see on the left side are the impulses. So what you see on the top is the gamma wave, how it's almost 30 to 40 amplitudes per second, or 30 to 40 hertz. Then we have the beta, which is coming anyhow from 12, 14, and it goes up to 30. And then we have the alpha, which is 6 to 12, ranging from 6 to 12, you will find it. And then we have the theta, and then we have the delta. So delta is almost 0 to 2. I will be again showing it, but this big machine were like this. But today, brain mapping have portable Bluetooth EEG showing simple visual analysis of brain activity. So there are softwares available which converts the hertz into brain activities by showing any sign. Like I've been using mushroom. So you will see our average coming in mushrooms. So how small it is, you see they are holding it. It can be kept next to the head of the patient. What you see in white, and a patient, the electrodes are on the forehead, only 3 electrodes on the forehead. Very easy. It goes on a Velcro, and you can see it. A patient can hold it also. So now it's a clearer picture of the electrode. Just three buttons, 3 dots over the forehead. and you see it's circled, it's very small. Hardly, you could say it's less than 100 gram in weight. And this, through Bluetooth, it comes on the computer, and that's how we record it. So there are 5 zones, what we can talk about it. Less than 4 hertz is delta, then 4 to 7 is theta wave, and then or theta zone. Then we have the alpha zone, 8 to 12 hertz, 13 to 28, or 30 is beta, because beta is subdivided into low, medium, and high. And gamma is 29 to 40 plus, depending on how much a person is in stress or how much a person is thinking. So the 5 zones are very well evaluated, a number of studies done by our students on brain mapping during their post-graduation. So another picture just to show you. So when the brain mapping is being done, so what you see is the prominency is alpha, beta, and gamma, and how it is there. The one much before, which will be theta, and delta, we call it it's sleep, and then it's the meditation. And alpha is alert and conscious. Yes, we are totally alert and conscious between 8 and 12 hertz, which is alpha and one of the best zone to be in. And once you go into beta and gamma, you are confused. Confusion, not focused, comes to that. This is how it will look. This is just one of the slide we are showing after doing the brain mapping. The hertz gets converted into mushroom to be more visible. It's a software which converts it into the peak. The best hertz are picked up in an average form and put it into a mushroom form. So again, both sides of the brain, left and right, and both the sides you see more towards gamma. Beta and gamma hertz are seeing more. The zone is more. Graphically, these mushrooms are present to represent the dominant and highest amplitude that is picked up by the software and put it on the frame. The left and right channels allow demonstration of brain waves, coherence, the same pattern of brain wave in the left and right side of the brain. So both are almost towards beta and gamma zone. So both sides are functioning in the same way. It's just a slide. And this is how it will work. So I'm going to start the brain mapping. So we have done on a patient, recorded. This is how it is moves. I told you the amplitudes are hertz. What you see down below, you would be seeing it now with the program. It looks in a mushroom. The peak are picked up and shown in a mushroom form. So what you see on the left are more towards delta, and even on the right side is more towards delta and theta, and very few mushroom on the right side is gamma. Fine. So coming to delta, I'm just showing you the slide, whatever you are seeing. So if you're talking about delta, I'm just going to describe all the zones first. So in delta, this is how it will look. And it's a stage of deep sleep in very experienced meditate or the people who are doing meditation. So once you are in a deep meditation, this is why if I do brain mapping, this is how your EEG will look. And coming to theta, which is you're just getting up from sleep, very clean, a little away from delta. This increases the susceptibility of the hypotonic suggestion. You can talk to people, and you can, like those who are into hypnosis or they do hypnosis, they come at that stage, which is the theta. When they're in theta zone, much easier to control the patient or the person. It is characterized by drowsiness, partial awareness, imagining. Dreams are again in this zone. When you are dreaming, you are in this zone. There is flickering of the eye or rapid eye movement of the eye. It's called the REM movement. So when you are in the REM movement, again, you are in theta zone. Coming to alpha zone, which I call it to be one of the best zone. It's a zone. See how on EEG will just look below on your alpha is it look at the right. This is how the EEG will look, right? But we convert it through the software into mushroom to show the average or the peak alpha zone frequencies that we have picked up. It helps in healing, positive thinking, awareness, enhance focus. They are focused. The patient or the sportsmen are focused. So most of our studies have been done initially on sports people to find out. And the best part about it is that whenever we asked sportsmen to think for the best game they've ever played, they were in alpha zone. And when we have asked them the worst game, which they were embarrassed talking about that zone, they were in gamma zone. So alpha zone is a zone. Most slides will talk about alpha zone later. And this is the beta zone. See the on the below what you see, how the EEG will look. It will be something like this for beta zone. It's high complex mental functioning associated with strong excited emotion. There is fear in the patient, anxiety, and attention, concentration, anticipation, hypertension. So when a person is in beta zone or gamma zone, you can take their blood pressure, they would be having hypertension. And see the mushroom, the average what you're looking all over the right side. Not stable. So you are seeing the mushroom on the right side. It's more to do with beta and moving towards gamma. So the next one I will show you the gamma zone. See the frequency per second has increased. See below, the EEG machine will show like this. See the increased frequency. And you see the mushroom on both sides, left side of the brain, right side of the brain, moving toward the extreme right, that is 30 to 40 hertz per second. Present in awake state, too many thoughts, seen in anxiety, person cannot focus under, and still a lot of research is happening, because I will just come to it. There are new researches about gamma zone. So basically 5 zones: delta, theta, alpha, beta, gamma. Our brain is divided into these 5 zones. And I'm not saying the lesser frequency is good, or neither the lot of frequencies, neither 30 to 40 is good, neither 1 to 5 is good. So you have to be between anywhere between 7 to 12 to be in alpha zone. That is the best zone. You are focused and you are exceptionally, you do well in that zone. So let's again summarize the zones. So to start with, delta is deep sleep. Theta, we will be dreaming and you're just wanting to get up. Alpha is you are focused and it helps in healing. Beta zone, excitement with stress, anxiety, fear, and rage. High complex mental functioning, always under tension. Beta. Again, gamma, present in awake state, always present with other waves, too many thoughts. New studies found. Right? So still studies are going on gamma to find out what all gamma, when you are in gamma, what all it can do. So if you look at the screen, theta and delta waves are more in children's because they have a lot of imagination and they have an inability to focus. The children are never focused. Too many things and fast changing. That's why the children are more into theta and delta waves. Then as you see alpha wave, it comes into you once you become an adult, you become matured, because we start getting the ability to focus, concentrate, and stay alert. So usually the mid, anytime after 16 years of age until 40, you could say you could be more towards, or you could be focused, or in short, I could say you are more into alpha zone. So again, as we grow old, so in old age, we have an inability to focus again. So which there's an increased access to memories. We think of our memories too much. So I always say there are possibilities we are more into theta and delta waves. Studies are going on more on gamma. Why it is we are moving towards that as we again age, because we become like children, they say. So the human brain responds to audio frequencies, which are oscillating sound waves. So we can work on a brain to try to get the brain into alpha zone or gamma zone or whichever zone we want. So there is a nice study which our department has regularly been doing. There's an auditory stimulus with binaural beats pre-programmed with the frequency of 8 hertz. So in short, I want people to know we should live in 8 hertz. 8 to 10 hertz is one of the best program, and that they are in alpha zone. Anybody who can go into meditation, anybody who knows meditation, so when they are doing meditation or they are in meditation, they are in alpha zone. Be sure about it. So what happens in this audio frequency that we have got? The listener hears a beat of frequency equal to the difference between the frequencies of the applied tones, like there is 170 hertz in one ear and 170 hertz in the other ear. So when you minus it, it becomes the alpha range, exactly 8 hertz. So you have to put your audio in both the ears, because if you put in one ear, it's either you are listening to 170 hertz or you are listening to 170 hertz. Only when you are listening to both, it get minus, and you are at your brain works at that 8 hertz, which is the alpha zone. This is one of the way of getting your brain into alpha zone. The other, I said, meditation. So meditation takes definitely puts you into alpha zone. And as we know, why I did it on sports people, because sports was competition. There is constant pressure on the sports person, and there is a fear of failure. So peak performance is required for excellence in competition, right? So we wanted to study the brain of the players who are performing well. So this is just a normal brain wave that I want to show you all on this. You see the mix mushrooms moving around, or the mix hertz or mix frequencies per second. Intervally, they hit high to the sky. That mushrooms are somewhere average head can hit the alpha and come down again. But what you are seeing on the right side, there is nothing there on the beta or gamma so much. But the left side totally confused. It's spread all over. The focus is not happening. Whoever this patient is or sportsman is, the focus was not happening. So I just want to say what we had done. We had done a study on why we were so keen on sportsmen. We wanted to know at what zone the sportsmen play. So initially we did a study on 1,000 college-going students. We just asked them one question: you are enjoying with your friends? When we did it, when we put the brain mapping on them, when we told them you are enjoying with your friend, you select with whichever friend you want, and whatever you want, you are enjoying. They were all in alpha zone. But as soon as we spoke to them about exams, they all went in gamma zone. So the confusion started, the anxiety started. So enjoyment always is alpha zone. So that's the unit that we have. It is not a music, it is not a sound, it is more to do with echo. The sound created by echoes. So that is more like, like saying the word Om, that frequency takes you into alpha zone. So this alpha technology was made by UK, and we call it alpha session. So we give it to the sports people before they play, and we wanted to see the difference, what they do with it. So we brought the sportsman into alpha state. What you saw earlier was the normal. So it took us time to talk to the patient, ask them to relax, ask them to focus for the current game. So you will see how the mushrooms are initially spread, then they come gathered, they all are coming to the alpha zone. Nothing at the beta or gamma. The right side corner, nothing. See, it is blank. So nothing to do with beta zone, nothing to do with gamma zone. We are very pure working into theta and alpha zone. This is the zone that we are putting the sportsman into, and this is the zone that we require a sportsman or all of us to be in this zone. See, as the time passes and we are talking to the patient, you will see more concentration of alpha zone, a very clearer mushroom that we are seeing. The application is drawing the peak hertz or the peak frequencies per second and converting them into mushroom to see it clearly there. So why we should put a sportsman in alpha zone? It enhances healing if they are injury or anything, or they felt bad on something or not performed in the earlier games. So it enhances healing, it enhances concentration and focus to get back to the game. If they are injured, they need to go back to the game. If they have not performed well, they want to get back. And this is what Alman said in 1992. Peak performance requires a spatial state of intense concentration, which is alpha activity or alpha zone, what we are calling. We want to put a sportsman into the alpha zone. So this study was done in 92 by Alman, and we did it on Indian sports people. So sports physiotherapists can play an important role in treating and training, but Also in preventing injuries. We prepare the best performances by getting the sportsman into alpha state or alpha zone before and maintain the state of mind during the game. So if we can talk out to our sports people and see that they are into alpha zone and they go to play with alpha zone, definitely the performances are great or the best. So we have found out when in the state of constantly winning and delivering optimum performance, it helps when you are in alpha zone. The consistent high activity in the alpha and theta range is called the alpha state or alpha zone. Now, when injured or not in form, performing well, the brainwave displays consistent high activity in the beta and gamma range. I said the frequency moves from 15 to 30 or sometimes to 40 hertz or 40 frequencies per second when the player is not performing well. But whenever they were performing well or they have performed well, it's very simple. You don't have to do it when they are playing. After finishing the game or before going for the game, if you put the EG machine on, they have to imagine. You have to tell them, just imagine the best game you have ever played. So the best game is always they are in alpha zone. And when you tell them the worst game, horrible you played and the country lost or your team lost the game, you would be finding them in the gamma zone. A case study about a sports people, a cricketer that we had found out. It's a case study. Initial state, no dominant brainwave pattern. The initial state before starting our treatment, this is how, this is the slide what we took of the brain mapping that we did on the bowler. Now after a week, then we were working. So this is how the slide looks. The bowler is very clear and in a deep state of alpha. Exactly, if you go to see, he's between 6 and 12, right? Peak there. So in the week one, when we were training him for alpha to be in alpha zone, the cricketer took 4 wickets for 32 runs, and then second week again we continued 3 runs and 3 wickets, and third week took 2 wickets for 40 runs, but the cup was won. And the fourth week, he took this career best 6 wickets for 22 runs. So because the sportsman was very clear, every time we send him in for the game, he was in the alpha zone. The zone reaching the optimum state of mind to deliver peak performance is alpha zone. So the studies that we are doing on sportsmen to find out what plays behind the mind. So we wanted to enter the brain and find out what is really happening. I can only tell to the audience that a tongue can lie, but a brain cannot. Right? So brain mapping is becoming a tool for sports physiotherapists. I say that word from Holy Quran: "He who heals one of my human being has healed by mankind." And physiotherapists are into healing profession. We should keep our healing on. I will just go to the why I'm saying that we should be using this map, because most of us sports people, when they don't perform well, they overtrain. Once they overtrain, we have got that overtraining syndrome. So what helps is to recover from overtraining syndrome is brain mapping. We have recently started. We have got 2 units in our department. The next unit we are using one only for sports. The other we are using it now for neurological condition. So we have seen stroke patient. We have seen a lot of neurological condition. When we get them into brain mapping, it's to know better to know a patient a little better. What brings them, when we talk to them, what brings them into alpha zone. So if they can do the physiotherapy under alpha zone, they perform better and the results are better. That's the idea. From sports, we shifted into neuro. Hopefully, with this pandemic, we have not tried still on our COVID patients. So very soon we will be talking on to see if it's going to help in the cardio also. Vardha Rajalu, I am open to questions, and any question that is coming, fine.
Yeah, thank you very much, sir, for your lucid and very much useful topic. Definitely, it is a feast, a scientific feast for all the participants who are all attending. And actually, it has given a good input, especially not only in sports, in all therapeutic conditions, including neuro area, this concept of brain mapping will definitely be useful. Um, Now, if there is any observations or any clarifications from the participants, you can unmute your mic and you can ask directly um, over to the participants. Any queries from the participants? Sir, there is one question. Sir, please explain more about brain mapping in neuro conditions.
See, it's very simple, very simple. Any neuro patient, they are into gamma zone. They are thinking about the future. They are thinking whether they will walk. They know they are already handicapped. So through this system of brain mapping, we know that they go into beta or gamma zone. So first we relax them. We make them listen to our audio signals to put them into alpha zone. So the way we see them performing after getting them into alpha zone, they are encouraged. They feel better. They are more convinced. It allows them to do all the movements we ask them to do in a much better way and longer way. Otherwise, they say we can't do this, we are tired and all that. So once you get them into alpha zone, they behave better, they talk better. And definitely we had done a study on upper extremity only for hemiplegia, and our other student did lower extremity. And we had found out result in both the extremities when we had put the patient into alpha zone.
Definitely, sir. There is one more question that this can be used, brain mapping, can we use it for the coma patients to know the level of consciousness?
No, yeah. Come again, your question, because I was reading that question, something else.
Yeah, no, whether this brain mapping, can we do it for the coma patients, comatose patients?
See, the idea is the response. We would know what is happening, right? We would know in what stage, how much they're thinking. If they're little alert also and they're thinking too many things, they will be in gamma zone, right? Or they are sleeping. They are sedated to sleep, so we find them in delta zone.
Yes, yes.
So if they are only semi-conscious where they want to respond to us, unless they don't respond to us, we won't be able to catch them in which zone they are.
Okay.
Otherwise, they are on a passive zone. So if they are on sedative, they will be on a passive zone. But once the patient can talk, sit, and they come to the department for treatment, a lot could be done with them. We have even Dr. Snehal Deshpande, who is only doing neuro peds. She had done on almost 20 of our pediatric patient, and we got fantastic result to it.
Okay. So there is one more question that what are the audio signals used for patients to get them into alpha zone?
Audio, I said it's an echo sound. Even simple om can do. Sometimes a person can come into alpha by blowing a shank, right? Or, repetition of any word. And meditation are many methods. If you ask a Buddhist monk, they have their own method. And people who go and learn meditation with other form, with a yogic or somebody, each person has a different form of getting into meditation. Some only repeat some word. Transcendental meditation is using a simple word and thinking the word is in your brain or in your heart. So you can go into alpha zone. Focusing, idea is focusing and cooling down.
So what is the scope of using the brain mapping techniques for the other conditions of therapeutic conditions, sir, like cardiorespiratory, orthopedics, and age related, whether that can also be incorporated in that?
I said I started it with sports, but then went to neuro. We have not, but we are planning this year because each machine should be specially made only for that. Because the programming in is such. I've done the sports programming, so suddenly if I want to be cardio on that and every time change it, it's going to be a difficult affair. So we have got 2 units. So we put the first one on sports, second for neuro. Hoping if we get another unit by a hospital, we'll be putting it on cardio and then doing it on the patient. But very, very beneficial in sports field.
Sir, question from my side. So whether brain map, will it be useful for knowing the motor recovery, sir, after the stroke?
Yes, That's what we want. See,
Yeah.
the results are better. It's like, making a patient, treating a hemi who is lying on the bed, eyes closed, and you are passively doing movement. I would say now that days are gone.
Oh, yes, sir.
So let us put the patient into which zone. We don't only want the patient eyes open. Again, the zone is important. So we have got much better result, faster result when the patient was in alpha zone than in gamma zone or beta zone. So gamma zone and beta zone characteristics showed they are not focused, they are in anxiety,
Yeah.
hypertension. So we don't want to treat. So first, brain mapping will help to get the patient first into alpha zone, and then when you are treating, the results are better.
Okay, okay. Actually, again, from my side, sir, whether this brain mapping, can it be useful as a tool of evidence of motor recovery after a stroke?
That's what Snehal Deshpande did.
Okay, okay. For a CP children's.
See, all this is good points. The worst point is when your own police friend wants you to find out who is doing what.
Okay.
So we get a little taken back by it because we are not, we don't want our machines to be used for other purposes. Whether the person is saying cancer, we have not tried. Prachi, I have not done it on cancer patient, but you have given me an idea. I will do it on at least 10 cancer patient and find out in what zone. But I'm very sure they will be in beta or they would be in beta or gamma zone because they know once they know they have cancer, the complex, the readings, the hertz or frequency per second moves away from 30. It is between 30 to 40 or 45. So I'm very sure that would be done, but I'm not done. So if I done, I would definitely let you know exactly which zone, beta, gamma, or whether they are in theta zone.
Okay. So, what are the main uses of brain mapping? Dr. Pankaj Mehboob Badi.
Sports. I would say I have done it on 1,000 college-going students. I told them you are enjoying with your friends. They were in alpha zone. As soon as I spoke about exams, they were in gamma zone.
Yes, yes.
So when you declare any exam, Dr. Varadaraj, you should know that you are putting them into gamma zone.
Gamma zones. Yes, yes.
But when you give them result and they have passed, then definitely all of them are in alpha zone.
Alpha zone.
But I'm looking forward for, a mobile bell rings. I'm moving forward that one day a mobile bell will be such. It will be such that when it rings, we will go in alpha zone. Our doorbells, when it rings, sometimes, you get alert. You get a shock the way the doorbell rings. So we should have a calmer and better sound effect on our doorbells. When it rings also, we should go in alpha zone. And definitely the pharmacologist, the pharmaceutical agency will try to get a tablet. So when you take a tablet, you may go in alpha zone. You never know. So we have to wait.
Sir, at your center where you are doing the this procedure, people whom you involve, sir, whether our physios are involved or you have a set of people.
Yeah. All my postgraduate students do.
Okay.
And no doubt we have neurologist Dr. Nathan coming to us. And I remember he telling his students that it's shameful on neurologists that a physiotherapist does better brain mapping than neurologist.
Yes. Very great work, sir. It is really making our own instrument for supporting the recovery of the brain or status of the brain. It's really very much useful especially the younger generation who will catch up the technological aspect of recovery fast. For such kind of students, definitely they are very much appreciating this process. Alzheimer's disease. What about the patients having Alzheimer's disease? Can brain help in make the better medication?
No, somebody's question was about CP patient.
Yes, sir.
CP patients were more towards theta and alpha zone because they don't have thought, they don't have any stress. Somebody brings them, somebody does them, they're just not bothered. So I've hardly found any CP child to be in beta or gamma zone. They're happy, everything what they got, what you give them, they're in alpha zone. Or they are, relaxed, they want to sleep, go to sleep, they go to delta zone. Alzheimer's not tried, not done on them.
Okay. So apart from the EEG, what other machines you will just use it as an infrastructure for brain mapping? What else are required?
I said I'm still keen to know that a day will come where you give me 10 very good cardiac surgeons, give me 10 very good physiotherapists, best physiotherapists in the world. I want to do the brain mapping and know at what zone they work. So when somebody wants to become good, we'll ask them to put them in that zone.
Okay.
So they would be a very good MD of a bank, very good chairman. So
Yeah.
this is the studies which can be done later on.
Mhm.
You have heard about the matrix machine, right? Matrix.
Yeah. Yes, matrix.
So it gives very good results. So we had done a study with Dr. Meenakshi Pune. She was using matrix rhythm. So when the patient was in gamma and matrix was given, the patient used to go in alpha.
Okay.
So I think so matrix, when I was discussing with the owner also who had made it, they say the frequency that they use is 8 hertz.
Okay.
It's exactly what alpha is. So maybe through matrix, you are bringing the patient. Why we are giving to sportsmen matrix, giving to all patients. So in short, you are getting the patient first into alpha zone. So this was a backup study which we jointly did it with Meenakshi.
Okay. So it
Nehal Deshpande we did for CP students.
yeah,
Yes.
brain mapping it is works on the mind rather than physics. Is it, sir?
So the brain works better. See, let me tell you again, gamma is between 30 to 40 hertz per second. So 30 to 40 is you're working too much. You're making your brain work overtime with confused anxiety. So brain should work between 7 and 12 hertz per second. That is perfect. You are focused. So idea of this is later as we are going our further studies, it's like whether we can get our brain into alpha zone in whatever form, maybe mobile bell, maybe a tablet, maybe thinking good, maybe meditation, maybe hearing, maybe repeating the word om or blowing a shank.
Okay.
Yes, brain mapping can be used in clinical setting.
Yeah,
You can use it for your patients.
it's very much clear, sir. Actually, the ABCD of brain mapping, we all come to know in wholeheartedly.
It's made very easy. Technology has made it very easy.
Yeah.
Overtraining syndrome, please, Nikhil. I usually ask one simple question to the sportsmen: how is your sleep? If they have disturbed sleep, if they can't sleep more than 3-4 hours, they get up at night, then one of them ask them that how much you train. You will ask them that first they were training only one session, they have started training 2 sessions. They have doubled the training. So these two signs is very clear that there is an overtraining syndrome. So you have to reschedule the training program, reduce it, increase their sleep. If they cannot get sleep, even if they have to take a tablet, give them a sleeping tablet with the permission of the physician and doctor, whomever they are seeing. Increase their water intake, and this will reverse the overtraining syndrome, and they will be back to normal. That was answer to Nikhil.
Yeah. Very nice, sir. Very nice presentation. And really, some practical sessions, maybe in future, some of the institutions, we will definitely take it up. Maybe at your center or when we are inviting you to our respective education institutions, where we will be definitely benefiting out of this, because it's really a brainstorming, sir. It's really good feast to all the youngsters. Yeah.
There's a question, sorry, there's a question on depression. Please, most of the patients who are in depression, it's known, they are out of focus. So they have to be in gamma. So if they're in gamma wave, how will brain mapping help? Showing them in black and white they are in gamma and they need to come to alpha. Then show them meditation, concentration, yoga, whatever way that they can come into alpha zone.
Yeah.
So how they can help.
Dear participants, there is a request from the organizers that you fill up the feedback form which is being circulated now in this thing, and so that will facilitate the organizers to improve on their performance in future. Then there is one more question, sir. Does the brain mapping have anything to do with the players selection for the upcoming matches?
No, not used. We are not. If we allow, you see, I am scared. Ours is the only department having physiotherapy department having brain mapping. Police comes to know everybody they catch, they will come to know whether the guy is telling truth or not. The best thing about it is you come to know a tongue can lie, a brain cannot.
Yes.
That is how I used to catch the players if they were telling a lie, they are injured. They should say no. So we could come to know. Or some they don't want to play a match. They were fit, but they wanted to say they are unfit, they are not well, they are injured. By brain mapping only, we could come to know whether they are really injured or not.
Yes,
So it can help in that way. But otherwise, the police will harass you.
Yes, sir. When do you break it, sir, so that everybody will try to use this brain mapping technique, which is being followed by physiotherapist and
Yeah, 2-3 things. Not available in India. I had got it from UK. The software also has to come from UK.
Okay.
So when any of our physiotherapy equipment dealers bring it easily to India, then training is very simple. It's in just like an EEG machine.
Okay.
And technology has made it very simple and easy. Rest is an X-ray. After an X-ray taken, it's how you are going to evaluate the X-ray. So once you have seen the brain mapping and the hertz, it's very important how you are going to match it or clinically read it. I didn't get the question. Mind reading, something it was.
Is the mind full as brain mapping? Question is not clear.
Yeah.
Yes. Dr. Deepak Anap, sir.
Yes, sir.
Panelist, any questions, any clarifications? We can ask. Swarna, madam.
Sir had explained everything so nicely. The only thing is that now we would like to visit your clinic, sir, your setup.
So students are doing very well. I've got some of your students with me in masters.
Yes, sir.
They're really doing well, and all have praises for you.
Thank you, sir.
Yes, sir.
So the only thing is,
we have your student also.
Yes, sir.
Yeah.
Yes, sir.
Hopefully things get better, and next session we would be doing a practical. We could do it and show you all the way we are doing the brain mapping.
Yes, sir. That will be
see the
welcome, and it's very much clear. Dr. Deepak Kanap, sir, shall we?
Sir, now Dr. Pradeep Borkar, a member of Ahmednagar IAP team, will say few words and then we'll conclude.
Okay, sir. Okay.
Thank you, Deepak sir. Myself, Dr. Pradeep Borkar, EC member of Ahmednagar District, Maharashtra. It's my privilege, sir, to propose vote of thanks today on this occasion of webinar. First of all, I would like to thank Dr. Sanjeev Jha, President IAP, for his constant support and encouragement, and also Central IAP team for guidance in organizing this event. My gratitude to Dr. Ali sir for delivering the talk today. Indeed, sir, it was a wonderful session, and I am sure everyone will be benefited by it. Thank you, sir, for giving your valuable time. On behalf of Ahmednagar IAP team, I would like to thank Dr. Varadarajulu sir, Principal KMS, College of Physiotherapy, Karad, for moderating today's event. It was a pleasure, sir. I extend many thanks to Maharashtra State Team, Dr. Ujjwal Yevle, President, and other team members for constant availability as when required. A special thanks to Dr. Abhijit Dute sir, Deputy Director, PDBBF, Ahmednagar, Dr. Swarna Ganvir ma'am, EC member of Maharashtra State Chapter IAP, and Dr. Deepak Anap sir, Convener, Ahmednagar IAP District Branch, for their encouragement and directions to conduct this webinar. I extend my thanks to our IAP Maharashtra EC members for their support. I also thank all members of IAP technical team for their technical assistance. Last but not least, I would like to thank all the participants for joining us today on Zoom and YouTube and making this event successful. Thank you all once again. I request all participants to fill up the feedback and to improve our activity next time. Feedback link is already shared in chat box. Thank you all.
Thank you, and all
very
the
much.
best. May
Thank you
God
very
give
much.
you a healing hand.
Thank you,
Thank you.
Varadarajan.
God bless. Thank you, Swarna. Take care. Bye bye.
Thanks a lot, everyone, for this wonderful webinar. Thanks, Ali Irani, sir. And thanks to all the panelists. It's really wonderful. I can say our brain cells get activated after listening to you. Thanks a lot.
Thank you.
God bless.
Again, I request everyone, please subscribe IIP India